One of the main goals of this podcast is to help our audience understand how CFOs can impact their business. Really, talking to CFOs, of course, is hugely important for that. But today, we're going to talk to a CEO and hear a CEO's perspective, someone that's built innovative companies to great heights and really has hired CFOs from fractional to full-time, and he's worn the CFO hat amongst many hats. So really happy to introduce Karim Nassar, and really happy to have you on the podcast. Thanks for being here, man.
Thanks, David. Appreciate it.
So we were talking briefly about the backdrop there. You've got that book, The Hard Things, About Hard Things by Ben Horowitz. Let me use that as a quick segue here. It's not easy building a business. You've done it. What made you want to do that? And tell us a bit about the journey.
I don't know. I think it's probably because I'm a bit of a control freak. I'd worked at all these companies and, tried to get something going on innovation ahead of MedNow. And it was always seemed to kind of fall back to this idea that P&L trumps all and innovation would be bought rather than built. So that's kind of why I wanted to go and build something on my own. And I was really lucky to find my business partner and just the team that we built around us that got me a chance to have a really good stab at building something. And yeah, but now still going, and love to talk to you a little bit more about it for sure.
Yeah. So the journey, obviously, to getting there, you talked about some of the roles that led up to that. You were more of a corporate environment, but you started off as an engineer. Did you have a different kind of path mapped out in your mind when you started, and how did that kind of develop over time?
Well, it's a great question because I almost bailed on my engineering degree probably 2 or 3 times because I just didn't care for what I was learning. When I'm trying to figure out, the EMI waves emitting around a cable transmitting power, all this stuff was like, okay, I know I'll never use this information. Business was always sort of in my mind, something that I wanted to touch on. I had my own little eBay business on the side when I was at university, and it's where I got into flow, when I was selling something. I was still going to stick to programming at first and blush. It's what I knew I was really good at doing. But then once I got into working and that being a full-time career, I decided it wasn't for me and that I want to get down to somehow touch the business and more of a global view of how all this technology that I was building, how does it eventually serve somebody and how it makes some money. But engineering was definitely a great foundation for solving hard things, for what it's worth. It helps you break things down in small little bits and then tackling one at a time. So I don't regret it for that reason, but I would have been maybe a better probably lawyer or just jumping into BCom right off the bat. That would have probably put me in a fun place.
You really chose a path in terms of, I call it healthcare more broadly, where there's a ton of complexity. And then you got into the pharmacy business. Like, that's not an easy place to go. And then you're trying to innovate in digital pharmacy and do something that hasn't been done. And I suppose that does tie back to being an engineer and really liking something that's sort of complex and understanding the nuts and bolts of it. But then you had that bigger picture and the desire to see the end. The nuts and bolts, and how do you kind of map it out, and maybe leading to the MedNow and the whole idea around it. You could talk a bit more about that.
I hope it was that logical and sequential in the way it kind of developed, but unfortunately it wasn't. And I think the last thing you said, which is really kind of like thinking about solving a problem with the end consumer in mind, is something that you almost have to learn to get to, because we all have our impressions of what our customers want, but until you start serving those customers long enough to realize what is it about your service or product that's not meeting their needs, that's the only time where you get to really know who your customers are. To your point about engineering being a good being a good tool to have in your toolkit for healthcare, absolutely. Technology and healthcare are inseparable. In fact, healthcare needs more and more technology, and I'm hoping with the new push of AI that we will somehow manage to contain that beast to getting it to a point where it can be involved in medical opinion and just support for doctors and such. But the irony of this, actually, healthcare was completely accidental. I didn't plan to go into healthcare. It was more that after I finished my MBA, I was kind of looking to either continue in something that's technology like and just do the business side of it. But the reality is I got a job offer for a gig in Paris, France. And I said, well, then the other two was New York or Toronto. I was like, you know what? I'd love to go to Paris. And that was for a home healthcare company that was in the making of industrial gases. But specifically what I worked on there was marketing, building out strategy plans, and doing things like country studies on how can I sell home oxygen profitably in Spain, or how can I get sleep apnea working in Portugal. It's kind of fun because you really get like head in first. What is going on with healthcare in a luxurious, socially supported market like Europe? And then, to think of the next parallel being Canada, leaving Paris to land in Edmonton on November 21st, of 2010, as I remember it, was such a switch and a shock in every way, physically and culturally and mentally. But it was a great first experience in running a business, because that division in itself was a P&L of say $5 million. And hadn't made budgets and targeted sales targets for a long time. And they'd been missing a lot of people to get the auction delivered, to manage all of the drivers, to run the retail clinics that were selling sleep apnea. So it was a lot of fun building that team up and getting into a place where, it worked. The part about running a business, the most unpredictable part of it is the human factor. You got your star employee shows up, they've had a bad day, they have a fight with their spouse in the morning, or, their car got smashed into overnight, and it totally changes that productivity for that business that day. And so, it was really getting much closer to people was definitely the key learning from that experience. And then, one thing led to another. I was in Toronto again doing M&A for the same company. That's how I really got into being the engineer that's in healthcare, because it was all numbers, getting that lesson of best way to measure a business is through its P&L and its growth prospects. And we bought a bunch of companies for this large, at the time, 25% representative of the market share, but it's been having all these little independently owned and operated companies come and nib at its heels and take away its market share, undercutting it in price for tenders on the auction side, or giving free stuff on the sleep apnea side. And then one thing led to another. It made sense to just go and buy these companies. And so that was the last stop I did at the home healthcare side, but definitely put me in a very good place to understand the value of a finance professional that knows what they're doing when it comes to M&A, when it comes to valuations, when it comes to diligence, and everything else in between.
So wanting to learn French
I know it's
got
a bit
you
of a
as a
journey.
lifer into healthcare. And funny enough, I have a bit of a shared experience in that I just wanted out of audit when I was with KPMG. I was like, get me anywhere. And pharma, it was just a random, happened to be, I was interviewing with different types of companies. And I got into the pharma world, and I had no idea. I love your mug. I can't even say what it is for those that are just listening to this on audio.
It's completely censored.
Yeah. check out the video. We're not censoring. But I hadn't heard of health economics, which is something I know you've been heavily involved with, and then the whole idea around how finance can make an impact in an environment like pharma, where the person that uses your product is different than the person that pays for your product, who's different than the person that decides, makes a decision to purchase your product. So I love that, because I thought, well, there's a complexity there, and finance can have a huge impact on helping drive that business strategically. Did you have some of that same kind of view when you got into healthcare, that you started to just fall in love with the complexity and the ability to understand all these kind of moving pieces and and make an impact?
Totally. I mean, one of the things that I learned early on in healthcare, and it probably struck me while I was still not, when I got started in Alberta, is how much healthcare is a bit of a supply chain business. When you start thinking again about this sort of delivery of product service to patient, if I was in Alberta, I was doing the delivery of medical devices and medical gases. When I got to, eventually McKesson, that was, of course, medications, one of the largest wholesaler in the world, Fortune 11 company, and they're making all their money by getting all of these drugs to pharmacies that eventually get them to patients. Yeah, the math is a really easy way to measure all of that value transferring down the chain. But also, if you think about like health economics, and after McKesson, I was kind of inspired to try to understand, to your point, exactly like the problem better. Like, really, what is the problem of healthcare? And then, again, I wanted to find a way to be more objective about it rather than the subjectives, like, oh, I wait too long at the doctor, or it's like, I still don't feel great after taking this medication, which are all clearly, things that we experience and they're real problems. But understanding like, why are you in this position in the first place is a health economic problem. It's like, what is this public policy that is in place to support every citizen of a country there to do, but to make sure they have easy access to healthcare that eventually will make them feel better and therefore live better lives. They're more productive. They cause the economy to grow, and so on. So there's inherently a good connection or good motivation for a government to keep their citizens healthy. Health economics then was the reason that MedNow made a lot of sense, because in extracting value from a preset game plan, which is the government prioritizes paying for services at doctors and not at pharmacies. It made sense to think about, okay, how can we create value through a virtual pharmacy? Because we're redirecting the attention of a pharmacist to being more clinical than being more technical, which is basically counting pills into a vial and everything else that surrounds that problem of workflow.
Karim, I recognize I brought it up. It's my fault without defining health economics. How do you think of just giving our audience who may not have heard the term health economics, and you've kind of alluded to it a little bit, but how do you define it?
So again, best asset of a PhD, but health economics is the best way to describe it is it's a way of measuring the value that healthcare is providing a population. So if you think about value-based healthcare, which is a common term that people talk a lot about, which is like, I only want to pay the provider of healthcare if I get positive outcomes out of the interaction. So I don't want to pay them if I'm still sick a year from now. And so that's kind of the concept of the value-based healthcare system. And so to measure that exchange literally of value, I pay you, whether it's through my tax money at the public healthcare setup like Canada or Europe, or privately through the US reimbursement model. In either cases, I'm exchanging value for a service or a product that makes me feel better. And so health economics, in the same way that economics serves us in the free markets and understanding every other business, health economics now values that outcome improvement. And so I'm feeling better. What does that mean, from a point of what I'm providing to society? So there's this idea of CALIs, what is the quality of your experience? And you can measure the CALIs and add them up and subtract them based on how well the service is going.
That's like a quality adjusted life year. Is that?
Yeah, exactly. How can you create sufficient value in a product? Now, it's great for governments to talk about stuff like this, but when it came to business, it clearly was, okay, what does these customers need in order to feel better? And we get that feedback directly when you speak to them. And so, but it starts with every company kind of thinking about that. What value are you providing that customer? And if all of us kind of collectively move to improving that value, then as an economy of healthcare, we're all caught up.
Awesome. I would not have gone close. I would have had to Google the definition, but that might be the exact Google definition. That was excellent. Bringing that forward to the idea behind MedNow, and I don't want to fast forward too quickly here. There's a lot in between from the McKesson time to founding MedNow. Just give us a little bit of that next phase of the journey.
While I was doing the health economics thing out of Washington, I ended up doing a bunch of consulting for digital health companies. And that taught me a lot about what startups are, and, how to really, what kind of challenges they might have. And so after that, I ended up going into specialty pharmacy for a bit, which is all the really, really expensive drugs that are coming out these days, whether it's for cancer or other. The note was around like, how do you sell a high touch, high service patient support program to patients, to manufacturers of pharma, and also just again understanding the sale process of a program. With that, I was building that now on the side. By that point, I had met my partner already, and we started working our way on getting an MVP to market. So we started raising money, and take it to being a real company. And so that was 2019, 2020. That's when I got started with MedNow.
Before we go there quickly, just because you had mentioned patient support program,
Yeah.
and I'm going to put you under the definition spotlight again here. What I could say about it is, from a budget perspective, every pharma company has a patient support program, and it's a significant investment that they make in getting their drugs to patients. What is it? How do you describe it?
So in my mind, it's necessary to support every patient who's on a medication, regardless of how long they've been on it, regardless of how well they believe they know their disease and the drug they're taking to help them feel better or solve their further outcomes. But the reality is, look, we're constantly changing as people. And the more complex our drug is, the harder it is going to be to take. And so patient support programs are really there to make sure that in cases where the manufacturer of the drug can afford it, they will pay somebody to take care of you while you're on that medication. Now, the unfortunate part is that the assumption in doing that is, anything that they can't afford to pay somebody specifically to do that for you, they're counting on the public system or whatever access to healthcare that you might have already to help you get through your drug journey and how well you're moving along. But the reality, of course, again, like a place like Canada, MedNow exists to solve for that case for everybody else who was not on a patient support program, where it was very easy for me now to use this amazing pharmacy that will actually check up on me, make sure I'm taking my medications properly, blah, 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 and everything else that is around it. But patient support programs, I think, really represent like the best way to take care of somebody who's on a medication. Unfortunately, again, because of the way the economics works, where it's a manufacturer that creates the program, that requires a third-party company to come and do it for them to maintain a bit of an arm's length relationship between them and the patients, because they can't be selling the drug and also managing their care. So that third-party company is one that I joined, which was Innomar, and they would earn a fee for service to do a bunch of different things like calls or follow-ups or navigation reimbursement. And eventually, verifying that you are going to be able to pay for this very expensive drug and you're going to take it properly. It kind of all came together with Innomar and then translated to from specialty pharmacy to now doing really the retail pharmacy category, which is every drug that we all know, but in a virtual form.
And was that a function of everything in the world going virtual, healthcare kind of being this last frontier, pharmacy not really having was there another company comparable situation where somebody was taking pharmacy virtual? What led to that realization that there's an opportunity there?
Oh, 100%. So there, the pioneers in the business, probably I'd call one out as probably one of the best in having started all of this sort of online pharmacy delivery in Canada. And that's Felix Health. Now, Felix started off with a focus around primarily lifestyle medications. So, Viagra, birth control, things that would normally have the convenience of delivery and anonymity that comes from it being in a brown box that gets delivered, and not necessarily, serious maladies that require constant attention of a doctor or a pharmacist along the way, like if you're a diabetic or hypertension or cholesterol, where somebody needs to really manage your care. Felix had done it already. We started before COVID because not for much, like we'd had all experience at McKesson. I saw what was going on with retail banner programs and the experience of the members of retail banner programs, which is a buying program that McKesson would put in place to allow for movement of drugs from their wholesale facility to pharmacies. And so that was, my view of retail. And then, of course, my business partner, him and his partner had bought a bunch of pharmacies and been pharmacists their whole lives and know the problems that they hear their patients and their customers complain about. And so it was an extraction of all this to say virtual makes a lot of sense because pharmacists who are out there really wanting to help their patients get better, a lot of times don't have a lot of time to do it because they're busy doing all of the technical competency parts of their scope and not getting to access their clinical competency as much. And so, yeah, it was more of this is a natural progression. Then, of course, to your point, it helped a lot that people were already on the phone from pretty much everything else. But it was also from a healthcare point of view, it was a natural and needed progression to take pharmacy from being an in-person experience that's only available synchronously, as I have to go and talk to the pharmacist, get them from behind their counter and talk to them, to being virtual and asynchronous, where now we can have this really cool exchange by text. And if we really need to talk, we can hop on a video call and arrive to the same conclusion. But it's planned and integrates into my lifestyle as a busy professional or busy household manager much better than the traditional pharmacy model.
So from there to $150 million or $145 million IPO, what was that journey like? Was it a straight line, or were there pivots along the way? And
definitely.
And how long was that process as well, from ideation to your IPO?
Ideation to IPO, would probably say about 4 years, maybe 3, depending when you can start counting. And I think it's mostly because when we IPO'd, we were just out of the oven kind of thing, in the sense that we're, for the most part, pre-revenue. But we'd established the operations with the purchase of 2 pharmacies, and also had a decent app out the market that could access these pharmacies and really, get these pharmacies busy. For a business to really have like that, to hit scale, and I could talk about that a little bit, later, but, it probably needs 10 years, maybe 5 to 10 years, just because of all of the changes it needs to do to customer purchasing behavior to get to this place where, we've got a lot more coming down the pipeline. And in terms of pivots, that was a lot of what can come up. For example, we were all direct to consumer at the beginning, and then realized that one of the many pivots was that we need to really concentrate on business clients and enterprise, because that's how you build scale in Canada for healthcare. Consumers are making the decisions, it's their employers that are.
In healthcare, I don't know. I've seen that in my experience in health tech, where direct to consumer is the starting point, and then a shift to the B2B.
Yeah.
And maybe that's Canada specific, although I suspect there's some commonality there with the U.S. market in that. And I wonder if this is something you saw in the world of pharmacy, but just broadly in healthcare, individuals don't want to pay for their own healthcare, whether it's prevention or addressing a sickness. We're accustomed to having insurance or government insurance, pay for that. So totally. Unless it's fitting into, your bathing suit for the summer, folks kind of stop there in terms of willingness to invest. Is that your observation?
100%. No, I think you're on the money in everything you just stated. The issue of having free healthcare and the benefit, of course, is obvious. Everyone understands it. But the issue is, as a consumer of free healthcare, you're used to not being picky about free things. You're not going to say, oh, that free mug that I just got from that event, I wish it was red and not instead of blue. And I think it's a little bit like that in healthcare. So, yesterday I was with my family to see an ENT with my 2 kids. And we show up and, very confidently, the receptionist declares it's an hour and a half wait. And we've got 2 kids under 5, close to bedtime. So you can imagine it was like, okay, what are we going to do for an hour and a half in this, gloomy blue medical building that we're in? How dare you leave the space, because if your number gets called and you're not there, well, that's it. You got to wait another, 6 months for that specialist appointment. So,
And you're
In a
starting to
lot of
break
ways,
down their workflows already in the business and say, hey, where are the bottlenecks here? Where's the
yeah.
opportunity?
Well, the bottleneck there, unfortunately, is so painfully clear in the lack of supply of doctors, or at least the lack of paying for
Yes.
doctors. We were definitely frustrated, but what can you do? It's not like you can go and say, well, what if I gave you, $100? Would that get me, 50% ahead of the line or all the way? And that's what the US model is exactly, right? If I wanted to get care faster or get care, better care, I can pay for it.
Yeah.
But it comes with the obvious disadvantage of if you don't have the money, you don't get the care. The advantage we have is if you can lean into for-profit businesses like a pharmacy or like allied healthcare, like the therapists of massage or physiotherapy, or what have you, you can lean into them to being there to support a preventative model of care, and then just really leave public health care for when things are really difficult for anyone to solve, unless they're, have access to the resources of emergency doctors, hospital beds, et cetera, et cetera. If you can create a model where those for-profit businesses are being motivated to really fill in that gap that the public healthcare is clearly not able to meet, then you've got a really good compromise between those two models. MedNow had to deliver every medication, and when you put that back on the P&L, that delivery cost, it robs most of the margin that comes from selling that medication. And so why would I, as a business, be motivated to do that unless it's somehow subsidized, for example, or that my dispensing fee would go up if I'm delivering the medication versus if I'm just handing it to somebody who's standing in my pharmacy. But that's the kind of conversation that's missing today, that no one's really talking about. They recognize it as now, as a private payer, I want to control that supply chain, and I want to bring better care for my patients, because if they get better care, then I'm going to be able to probably not have to worry about paying for their disability, these members of plans, right? Because that's the kind of thought process that private enterprise like a Sun Life or a Manulife or all these businesses can do. Our government needs to get there, and I know they'll get there, but it's just, how bad does it have to get first before they do? But again, if it's free, you might not have a choice, but continue to wait until it gets sorted.
It's amazing that we can't seem to connect the two and talk about the private public working together. Just private seems to be such a dirty word in politics, but it's a sick care system. So I'm with you, and
that's well said.
Yeah, exactly. I think we could probably have a separate podcast episode diving down
just on that,
this rabbit hole. So coming back, let me ask you about, and we're going to shift to CFO, but starting with the CEO, yes. What was it like for you taking on the CEO role for the first time in your career? And I suspect as a public company that puts a different sort of spotlight or emphasis on CEO and some of the competencies and challenges that come with that role. So what was your experience like?
I could say that it was never part of my original plan coming in. I just co-founder, and I take care of all things operations and technology and a little bit of finance, in terms of managing vendors, like accountants and lawyers and fractional, everybody else in that category. The decision was made that we go public, and then we needed a CEO. And between me and my partner, it made sense for me to be the CEO because he was already running, or rather he was sort of in a leadership role at another company. My sort of corporate background and training and communication, being in strategy, and having been in a few business development opportunities, made sense to be the guy who's talking to investors and encouraging, a very informative and positive IR conversation around what is this new business. We didn't have any comps in the market that were public. There's no digital pharmacies. That was on the public market. Every digital pharmacy was private, and so just the challenge of the valuation in itself was tremendous. And then explaining that story and what stock is going to represent in terms of a comp for a microcap company was almost something that we had to create completely from scratch. And so that was a fun problem to tackle. And then, just to kind of finish off on being a CEO of a public company, it started, of course, as me being the CEO of the private company still. And we would, do things like investor newsletters and, find every way that we can to keep people up to date on what we've been up to. And then, going to public status now, it became all of the regulatory bounds that we get put on communication and got put on what we're able to do and how quickly we're able to do it. And in a lot of ways, being in the innovation business, being public is not always a great thing because it does control what you're able to do. On one side, from a regulatory point of view, especially if you're in the healthcare business. On the other side, your ability to communicate about anything that's a competitive advantage that you are putting in place so that you can serve your customers better is also limited. But it's also the reason anybody in the public market is going to invest in you because you're innovative, right? So you have to kind of constantly carry that balance between being a business that is innovating, but has to look like a business that is growing and has, the clarity on it, at least from a team point of view, on how to get innovation done until it's proven in revenue, which is the only thing that the market knows how to measure and measure really, really well. So yeah, so that was a fun transition, but it kind of it allowed me to really play in an area that I probably wouldn't have been able to touch, like investor relations was the most fun I had when I was in that COC, for sure.
So maybe a good segue to CFO, because this is where a lot of companies, before they go public, need some help getting their financial statements
100%.
audited. Many times going from private company GAAP, ASPE to IFRS, and the whole level of complexity on financial reporting goes up significantly. Not to mention getting a prospectus, getting investor relations ready.
Yeah.
How did that journey look for you at MedNow in terms of, and I'd love to even go back to sort of what was the finance function before, and then decision to go public. How did the finance function evolve throughout that process?
So one of the really unique things about the business of pharmacy as a healthcare business is that it's very easy to split your P&L down the middle and say, here are my pharmacies and here's what they can do as a standalone business. And then there's everything else, in this case, being a technology company first, and then a technology company that's also public second, and how that changes that side of your P&L and how it grows your administrative burdens and all of the things that you need to put in place to really grow a technology business efficiently that eventually feeds all of these independent P&Ls in the form of pharmacies across the country. Generally, as pharmacy is highly regulated, there's only so much innovation you can do within the pharmacy itself. There are boundaries to what softwares you can use, what, they need to be licensed for use. It's not like you can just, decide, okay, an example would be a pharmacy management system. A pharmacy management system is essentially the operating system of a pharmacy. All of your prescriptions get put on it. The billing is happening from it. Patient outreach is happening from it as well. And a lot of these PMSs or pharmacy management systems are quite dated in their user experience because it takes so long to get them built in the first place. Have to be robust databases, and they have to get approved for sale in Canada and licensed. Blah blah blah. By the time they're there, getting them to look like anything you use day to day today is you got to wait another 5 years kind of thing. So all of our efforts to optimize pharmacy were for the most part around the pharmacy, and so that was the stage one of MedNow, which is building that technology, and that was again a lot of what I focused on to get it to a place where now, okay, I can see how this tech can plug into these traditional pharmacy assets and start growing them and making them more profitable. We had clarity around the finance function that was the pharmacy and the operation that is running as you would expect every other pharmacy in the country to be running. But it's above that, that work was mostly being supported by between me and my partner and leaning on an external accounting firm to kind of move us along in how we're spending the money that we raised and how we're which was mostly what we did at the overhead level. There was a lot of spending. We weren't really earning still on at the sort of the top level. The predictability of a pharmacy P&L and everything that was in it was easier to manage, relying on what the resources that we already had access to. And then on the flip side, technology building out, that was for the most part money going one way to get built onto tech side. And so from an accounting point of view, as a private company that's technology, it was really more how do you spend that money efficiently to make your runway last? Or once we were about to go public, that had to change. And that's when we needed absolutely a CFO to come in and start representing now the regulatory responsibility that's now going to come with moving to a public entity.
And did you find a CFO in a pretty successful manner? Did you have to learn along the way? What were the sort of profiles that you were thinking about, and did that kind of change from day one to what you think now, as far as what you would go seek? And we've talked about this before. Certainly something on this podcast that I want to illuminate, which is the various profiles of a CFO, the types that are really great when it comes to the foundation, the financial reporting capabilities, and the regulatory, and then those that might be a little bit more, let's call it market facing and investor relation oriented, capital market savvy. If you're doing M&A or some of the things that a CEO would really like a CFO support. So give me a sense of which of those or other sort of aspects of the profile you were seeking, or would go back and change if you could.
So when we were going public, so this would be second half of 2020, and it just kind of wrapped up our private placement round. I raised about $6.5 million in that, talking to mostly retail advisors that were out there with high net worth individuals. When we got to now the decision to go public, the market was clearly very, very hot. This is, the sort of COVID era was now in full fledged, and people started understanding what this pandemic means in terms of, everything has to be socially distanced. Ideally, get your everything delivered. Anything you can't get delivered, get it delivered, and just stay home, close the door, and toss the key away. Like, it was a very much an opportune moment for a virtual pharmacy to be coming to market. So from a CFO finding, and the decision to hire one, it was probably like drinking from a fire hose. I mean, it was all of a sudden you're like, okay, I'm worrying about what's going to happen with the next release of the app, or I'm worrying about what's happening. Where's the pharmacy, infrastructure at? Are we on the other side of fixing everything that was broken from these acquired pharmacies? So we had bought existing pharmacies. So it was a massive cleanup and a massive rejigging of everything to allow for a virtual workflow, which, for all intended purposes, the most important thing is that you're no longer handing that white medication bag to your customer at the end of the dispensing act, but you're doing it instead into a box that's going to be labeled, it's going to get delivered somehow, it's going to make it on the same day, and I need to know exactly when it got delivered, and there's a way to trace that back. So there's a lot of, the complexity of upgrading the logistics and the back end of pharmacy to make it fit into the virtual model that we were after. And so that was mostly what we were all obsessing about until this moment. Now, okay, we're going public, put together prospectus. And I was like, what's that? And it's, in a moment, you've got to describe the entirety of your business in a very specific kind of way. Just for the, I'm sure a lot of people may have seen some of these if they're investing in the public market. And, to permit for this initial public offering to take place in a way that is indeed going to matter enough to investors that they want to invest in it. The last thing you want is a, blind leading the blind moment. Because, for my partner and I, we'd never run a public company. We'd never take a company public. We may have done, invest in stocks and whatnot, and have a very good understanding of financial statements at various levels of diligence, but we never take a company public. So, we had to lean on our advisors at the time to find a CFO, and the decision was to take in a fractional CFO, who, in very much as you described the different profiles of CFOs, this particular CFO, one of the best people I've worked with, knew exactly the process of taking a company public, because they'd done it before, many, many, many times. And so really experience, and very specialized experience, that is fitting that kind of problem that you're solving right now, which is, to your point, may not be the problem you're solving once you're public, or once you want to start growing by acquisition. We needed that kind of skill set then, but we didn't really need it afterwards. And so, and there was a very clear understanding that that's how that relationship was going to go. We're going to have that person come in. They're going to help us get to a place where our prospectus is informed, and all of the regulatory requirements to go public are met. The negotiations around escrow agreements and subscription agreements, and all the guys that were private now going to the IPO round. Like, it is, a whole sea of knowledge and things that you never would have to think about, even though you're trying to solve what would be otherwise a very complicated problem, which is like, how do I deliver pharmacy products to somebody's home? And you can see why, that specialization was so key. So yeah, I would say once we had that experience, we now needed to get our full-time CFO. And, I think, back to that moment, I would certainly want things to have been very different. I'm happy to tell you more about that too.
Yeah, I don't want to stop you. I want to keep hearing. I mean, this is almost, again, back to the parallels in my own experience. I was the guy learning as I was going, and I guess everyone's got to do it the first time. Whether you're a doctor or you're an engineer. Yeah, I hate to say blind leading the blind, but you're going with the flow. You're trying to make the best decisions, leaning on your lawyers, your bankers, advisors around you. Google, literally trying to get as smart as you can, but nothing can replicate having done it before and knowing
100%.
what not to do and what to do, and guiding your CEO. So the fractional CFO, okay, worked great. You get the public. You're thinking about now the sort of ongoing need, which is different than what you needed to get there. I'd love to keep hearing that story.
When you think about that transition to, the need for regular reporting that is mandated, whether it's quarterly or any other form of, reporting that you need to do based on your disclosure requirements as a public company. Really understanding things like blackout periods, really understanding things like, what is a promotional press release versus that one that is accepted as non-promotional and therefore legitimate, and all of these little nuances, which you really, as a founder of a company, I don't think you ever understand the value of having a good communicator, on board when it comes to anything to do with investor relations. But now to do it really with that lens of a CFO that is familiar with their path around all things. CFOs, I find, when they come in, they're like I've ever seen that movie Pulp Fiction,
Mm-hmm.
like the wolf in Pulp Fiction. Somebody who knows exactly how to solve a problem really, really well, because to what we were just talking about, they've done it 100 times or more. And the efficiency you get in executing that task from A to Z as fast as possible is your preservation of runway that every startup needs to be most concerned about all the time. Build the product until you're profitable. And then once you're there, you can maybe have a little bit more fun experimenting. But if you're spending a lot of time experimenting and learning, and you're kind of all over a little bit until the moment of profitability, you're getting short on our runway, and you're not having as much possibilities of supporting the more important task, which is not just to innovate, but to be able to scale that innovation. A CFO that can put in place the fiscal policy, the internal controls, the ability to be very diligent in budgeting and forecasting what needs to happen for our technology milestones to be met, or our maybe M&A milestones to be met, far enough that we are profitable, which is really the goal. That is 2 to 3 years max, even if you raise $40 million. But at least I'm being very diligent in my approach to the point where I know that nothing that I can do today as that CFO can be but outside of anything but to advance that vision and that sort of runway becoming long enough to get to profitability. The psychology of growth, of revenue, above all, that's the most important thing. Everything else will come afterwards. All that died at the end of COVID, and not even at the end of 2021, middle of 2021. Nobody really cared that you're able to demonstrate magnificent growth on revenue if you're not profitable. Cash is king. Interest rates were going up. Everybody wants to make sure you will be around and you're not burning through your cash faster than you should. And so these are all CFO functions. It's like saying, hey, this is my dream scenario. You go, you buy a house, right, and you're going to want to renovate it. Okay, well, I'm going to do this. I'm going to put a sauna in the basement. I'm going to put a hot tub in the back. I'm going to put an elevator in the stairs. And then, you talk to your financial manager, which is usually your wife or your partner, your spouse, say like, well, we're not doing any of that because this is how much money we have. We have enough money to paint the house, fix these stairs because we need to get up and down those stairs and not worry about falling through them. And maybe we'll get a new garage door. It's that reality check and that sort of maturity and the ability to have a very clear view of P&L and of course reserves, being your balance sheet, is what makes a very unique CFO in a high growth technology company that's also in the healthcare space. I could tell you that it is something that would probably have not been possible if we had just, again, same CFO that brought us into public. That person couldn't have been that, high growth CFO for a tech or a health tech company.
And is that person at that point, are you moving from fractional to a full-time hire?
Yes, a public, permanent, more permanent than the fractional to get us public, but maybe not a forever guy either, right? Like somebody who can come in for that, sustainability moment, right? To get to profitability.
Yeah.
Because then you have a different requirement.
And a different profile,
right?
and a different profile.
Exactly.
Yeah. And that's one thing that's, clear. It's just hard to have one size fits all. And many people can
100%
deliver on multiple fronts. But if you really want to have, the most effective for a particular phase, then you're going to have to make changes throughout that time period. And I would assume when you have a transaction like a go public, it's a technical transaction. Industry or domain experience is not as necessary as much as how to deliver on that transaction. As you get to that next phase, when you're talking about more what we call FP&A, financial planning analysis, the strategic forward-looking P&L and cash management towards profitability. Would you agree that requires a much greater level of understanding of the business, commercial understanding, industry experience?
100%.
Yeah.
I couldn't have said it better. I mean, of course, this is your trade. You know it better than even I do. And I think in every way, the idea of what you described, especially around, now this is call it a grown-up company. We've got income, right? And we've got income that needs to also be managed, because now my runway is no longer a conversation. Now I'm worried about the efficiencies I'm running to get me to maintain this point of sustainability and continue to grow the income to a point where I can continue to invest it back in the business and then go after the next part of the market that I'm after, go after the next competitor that I'm after. And so, yeah, in a lot of ways, being able to do that well requires, to your point, that industry knowledge. So somebody who had been in pharmacy, again, we've always had the challenge with this business is that we didn't have that many people that would have done an online pharmacy in the TSXV, publicly listed company and knew how to run it with that. So it was a group effort to get everybody on the same page as we helped our CFO through with the industry knowledge required and all things that would sort of reasonably make sense. And if we had made it so MedNow is no longer public. It was taken private end of last year. And so they're kind of back where we started, if you will, but now with an established business in virtual pharmacy. So MedNow never had to solve for that last problem because never got to that point. But imagine if we had made it to that point, then yeah, 100%. It'd be a brand new description of a role, a requirement to solve for something specific. And then eventually, to being probably more corporate development minded, tons of M&A would have been sensible to do then. Because again, being profitable in a public company, raising money becomes much more palatable because there's a growth story and there's a path to an ROI that wouldn't exist if all you're doing is burning cash.
One thing I just want to double click on is something that you and I have had conversations in particular as of late And you're almost making it sound easy as far as the CEO. I know what I need when I need it at various points in time, but there is a lot of confusion for CEOs and business owners on assessing what's needed at a given point in time. And I see it all the time where I'll speak to a company and they think they need a CFO, but they just need a bookkeeper. Uh, they think they have a CFO, but it's just and not to diminish, but it's a controller, not a CFO. And this confusion is all over the place. And what do I really need? And sometimes you need it all. Most times, when you really hone in, there's one element that they need. How did you get there? And was it instinctive? Did you have the right people around you to kind of point to the problems? Give me a sense of that, because you had a lot on your plate, like running a business.
Yeah, so I would start by saying I don't think we got there. I mean, I think we got close to it, but I don't think we didn't land in an ideal scenario when it came to that aspect of our business to be able to say again we didn't make it sustainability, and there's a lot of factors that played into that. But I think I couldn't underestimate the importance of the obsession that would have come from being that sort of very tightly controlled. If I were to go back and again, hindsight is 2020, so I may make it sound easy, but it certainly wasn't. And going to your point around understanding what you need, I don't know if you've ever heard of that, and I'm probably gonna make a mistake stating this, but like Dunning-Kruger effect, where beginners solving for a problem, like today I'm looking to acquire a business as an example. I might have a very high level of confidence in my knowledge, despite my low expertise in solving this problem. And so, go back to experience. And that Kruger Dunning effect says that you start off at this high point of confidence, and then you slope downwards as you realize, oh my God, this is really hard. I don't know what I'm doing. My confidence is going down and down and down, and then it starts to pick up again as you build up the experience to get to the, to the peak of that, from that trough to now being an expert who's also confident because you actually fully understand the problem and have an understanding of how to solve it. The Dunning-Kruger effect gets founders in that they think, to your point, yeah, all I need is just another accountant, right? Like, come on, I got this, no problem. We can figure all this out. We can write this prospectus or overnight, figure it out. Like, none of that stuff works. And of course, we learned that. And that's, we had great advisors, to your point, our bankers that were there to tell us, be mindful of the fact that there's an expectation that you're delivering this level of disclosure. There's an understanding that this is what you're expected to do once you receive these proceeds and investment. That level of like having that mentors and advisors around us helped us maybe make some of the decisions along the way. But I still think, and I'm not just saying this because I'm talking to you, David, but the idea of somebody who's providing CFO services, who has the broad view of a market of many different sizes in terms of companies and complexities and industries, that's invaluable because your view is you're the fixer. I have the perfect professional to fix this. You don't know what you're trying to fix, and even if you did, you're not going to be able to go and access that professional and plug them in here while you need them before you plug them back out and then replace another professional. That level of advice, I mean, I think you can't pay enough money for it. I honestly think that is what preserves your runway. That is what makes you continue to grow. That's what makes you a legitimate and viable investment, especially when you're on a public market. Overconfident founders, they'll think they can figure it out, and they'll hire, band-aid solutions to your finance because you don't want to pay for a CFO. You're going to try to hire a controller. If you don't want to pay for a VP of finance, you go and hire someone who's a little bit less oriented because you're trying to save money here or there. But reality is it's probably one of the best investments you can make. A good CFO means you're going to keep more of your money that you raised and worked hard to get.
Awesome stuff. I want to kind of transition here to something before we close out, which is just getting, on the confidence execution or confidence competence curve that you're talking about. You're here and all the way at that peak in terms of you've done it, you've experienced, you've done amazing things. You talked about
maybe not all the way at the top, so I'm still working my way up that valley.
Yeah, well, ambition for what's next and a lot of exciting things. I think a while back you were talking AI. There's certainly a lot of opportunity in healthcare. What do you see in terms of the landscape and how you want to play in it, and what you're thinking about doing next? And you don't need to share any of the secrets, but yeah, just broadly speaking, what's up?
Yeah, no secrets. I always say ideas are a dime a dozen. It's execution is everything. So, going through the MedNow experience definitely put me in a place where I'm excited about operating businesses and growing technology businesses specifically. I'm very much growth obsessed. I love, something that gives you an opportunity to grow via innovation. Now that I've been through that startup grinder and getting all the way to, going public, I I realize there's probably a better way to get to the final goal of, making a positive impact in healthcare. And to me, that is buying an existing business that has the appetite and the tendency to be, um, first of all, more profitable, earn more revenue, blah blah blah, and using innovation, but also affecting part of our healthcare system. Businesses that have the right team in place to be that innovative starting point, instead of building something from an idea to that team. I want to buy a company that already has that team and is ready to go to the next level. Now, it's a busy market. A lot of venture capital companies out there are doing the same thing, private equity a little bit as well, especially now with cash being so expensive. Their requirement for growth has gone up. So they might go after companies that seem to be a higher risk play than, what a PE would normally go for. So they're after VCs, so rather after a VC strategy almost. And so, finding that perfect EBITDA revenue combination. Usually if you stay under 10 million revenue, 2 million EBITDA, you're still in the under radar, zone for acquiring a business. But yeah, I mean, I'm still early on. In a lot of ways, I love to be solving some sort of hard problem in healthcare. And I think, there's no hard problem as the one that we have here in Canada. And so I spend a lot of my time talking to people that are in the business of, providing healthcare. It's just from the network that I built over in MedNow, and then just kind of being inspired to what's the most reasonable thing to do next to really make a difference in healthcare. I end up, going back to really kind of going to the goals that I had for MedNow in terms of profitability, sustainability, and experiencing that next stage that I didn't get to touch when I was at MedNow. And so I'll definitely be needing a good CFO at that point, and hopefully I'll have that problem to solve.
Yeah.
But yeah, that's where we're gonna have to figure something out, you and I did.
Well, I look forward to seeing it, your success continuing and doing great things. And again, I think we've had a couple of points in this podcast where there's a whole other episode that came to my mind. So I hope you're willing to come back here
Anytime.
and maybe have a repeat episode or repeat guest situation. So anyways, you really are
Anytime.
awesome, man. Really glad that we got to know each other, and looking forward to, again, seeing you do and continue to do great things. So thanks for being here. Really appreciate it.
Thank you, David.